Hi, John Delzell. I'm here to tell you things you need to know about Medicare. Today, I'm going to go through a couple things just so you understand what Medicare is about and what are all your options. I know you get a bunch of stuff in the mail. They know when you turn 65, they know when it's open enrollment. They send out stuff, meaning the insurance companies will send out things to you maybe once just to let you know, then send it out to you again because maybe you didn't get it. Third time they send it out to you because they just had extra stock and they just need to send it all out. And that comes from multiple insurance carriers. So what happens is your mailbox gets full. That is one of the ways that they can communicate with you that is a non-hostile environment, um, hostile solicitation um, way that they can actually contact you. They're not allowed to knock on your door, not allowed to call you without a consent to contact form. Um, they can't put things on your car in the parking lot. They can't show up at the doctor's office. Can't hang out right next door to the pharmacy. They can't do a lot of those things. So what they'll do is they'll mail you a lot of stuff, but all that stuff gets very confusing. I know a lot of my clients, when they come in, they just bring a whole box full of stuff into me and say, what am I supposed to do with this? Just so you guys all know that there's only three components really of your Medicare choices when you turn 65 or if you're under age 65 and are totally disabled under Social Security. Those are people that qualify for Medicare. When you're looking at those things, though, keep in mind there are three components again, and I'm going to go through all of them. I'm not really going to get into real big detail on them, but I'm going to kind of tell you what they're all about. So behind me here, I'm going to show you just, and I'm sorry if this looks like I'm average Joe just telling you stuff. So it's on an Excel spreadsheet to kind of give you an idea. Trying to make it very basic though. When you turn 65, I'm just going to use it that way. If you turn 65 and you're drawing your Social Security check at 65, they will send out a Medicare Part A and B card to you. If you're already getting it prior to 65, when you're getting ready to turn 65, they'll send you your red, white, blue card. Shows your effective dates of Medicare Part A and B. Now, that is one option that you can keep. Medicare Part A and B covers 80% of the benefits. On the left here, I'm showing you the Medicare cost, the average cost based on your income. Some people pay less, some people pay more based on how much money they make. But the average cost is around $164.90 for 2023. Okay, you're going to pay that no matter what. That is for Medicare Part B. Medicare Part A, you've been paying for your whole life, coming out of your check in small amounts. You probably looked at your paycheck over the years and said, what is this Medicare when you were 35 years old, not enrolled in Medicare? Well, that's been paying for Medicare Part A your whole life. When you become eligible for Medicare Part B, Medicare Part A, they don't charge you for anymore. But then they charge you the annual amount, and it can change every year. This year was an odd year, 23, because it dropped. It dropped from about $5.50 or so, and they gave you a Social Security increase of about 8.7%. Usually, what happens is that they'll tell you that here's your Social Security increase. It's 2.7%, and then you'll find out a month later that your Medicare Part B went up 2.8%, and it was a wash. This year, it didn't happen that way. Actually, they lowered the cost of Medicare Part B, and majority of people got an 8.7% increase in their Social Security, so it was a good thing. But don't count on that. It changes every year. So for 23, that's what it is. As you're seeing here, 164.90. That's the average number for 2023. What that covers is Medicare Part B, or Medicare Part A, which is hospital coverage, and Medicare Part B, which are things like doctor office visits, lab, X-ray, outpatient services, everything else that's out there that's not an inpatient hospital stay that's covered under the Medicare benefits. The only thing that's not covered under that is prescriptions that you would get at a pharmacy. Okay, so that is not covered under original Medicare. They pay 80%, you pay 20%. So that's Medicare Part A and B. So 164.90, just to let you know, you never get away from that number. That's to cover Medicare Part B. So if anybody tells you that, hey, you know what, and you're not on Medicaid, and they say this is free, well, it might be free, and I'll show you ways that it could be a zero premium, but you're still going to pay $164.90 or whatever the Medicare Part B premium is for that calendar year. You never get away from that. And they're going to withdraw it directly from your Social Security check. If you've decided not to take Social Security when you're 65, and you're still, you decided just to wait to 68, but you retired from your job and you're on Medicare Part A and B, they will actually mail you an invoice for 3/4, so $164.90 times 3. So they'll send it to you 4 times a year, quarterly, You need to mail that back into them, though. Your payment, they don't automatically withdraw. So that's Medicare Part A and B. I'm going to switch right now to options that can go with Medicare Part A and B. Again, here's $164.90. You have to pay that still. It doesn't go away. But what happens is that there's choices for supplements in Medicare Part D. Supplements are plans that cover the 20% that Medicare doesn't cover. See, up on the top here, you are paying the 20%. They're going to pay the 20%. So in a Medicare supplement world, you'd have 80% being covered by Medicare, 20% covered by your supplement. In a lot of plans, you won't be paying anything for services, but there are some deductibles out there, and depending on what kind of plan you're under, there are plans A through N. Different insurance companies offer different plans. Some plans actually aren't even available to purchase anymore. If you have one, you can stay on it, but you can't buy it new if you're new to Medicare. Those can range anywhere from $125 to $250 based on your age when you go in there. 65-year-olds are going to be in that lower end. But if you're on a Medicare supplement, keep in mind, this goes up every single year. It's not a standard rate when you sign up. It doesn't stay there. It goes up every year as you age. So depending how old you are, it could be in a range of about that much. That's covering your 20%. Okay. Then you need to get a prescription drug card, Medicare Part D, to cover your prescriptions at a pharmacy. Okay, those are going to be copay driven. Some of them may have a deductible up front. Again, this is based off the plan that you're choosing. If you think about this in a car insurance kind of a way, if you're a good driver, knock on wood, I am, I'm not going to buy a car insurance plan that has a $100 deductible because I very rarely would get in an accident. So I'm going to take some risk on myself and say, hey, I'm probably going to be a good driver, so why don't you let me cover the first $1,000 in claims? What happens is they trade premium dollars for benefits. So the higher the deductible, the lower the premium. The lower the deductible, higher premium. So you want to think about your own, prescription drug usage. If you're not taking anything, why would you buy the Cadillac when you only needed the Chevy or the Yugo? Or sorry if I made fun of anybody's car, but so consider that when you're looking at a Medicare Part D plan as well. Those can range anywhere from $7 to $140 based on where you live and all those kinds of things. But again, those are all different plan designs, kind of like plan A through N. There are different things that are covered under different plans. So when you're evaluating those, make sure you look at those options. There is one thing when you sign up for a Medicare supplement plan, the first time through, right when you become eligible, initial enrollment, you do not have to go through medical underwriting to go into Medicare supplement plans. Although, if you decided that you weren't going to sign up when you were originally eligible, and let's say you signed up for a Medicare Advantage plan, and now you want to come back later and sign up for a supplement plan, you can still do that, but they have the right to put you through medical underwriting, and they can actually decline you if they wanted to. So they don't have to take you. But they do have to take you the first time through. Okay? That's the second option. You can do that. You can have a straight Medicare. You can buy a supplement or a Part D plan to go with it. Or the third option is going to be, and it's kind of one of the more popular options that's going on now, are the Medicare Advantage plans, Medicare Part C. Okay? And again, that mailbox is full of everything that's supplements, drug cards, Medicare Part D, and Advantage plans. But they're coming from multiple insurance companies multiple times a year. So apologize to your mailman ahead of time. So they're going to be getting a lot of stuff in the mail for you. So when you look at the Medicare Advantage world, what they are is that they take into consideration that Medicare is paying 80%. They then, what they do is they cover what the supplement would have covered and a Part D plan, so that 20% and the prescription drug card, and they package it all into one plan, Medicare Part C. It's a Medicare Advantage plan. So what that would do then, if you're looking at it down here on the bottom, sorry if this is primitive again, those can range from $0 a month to, say, $139 a month, depending on what kind of carriers you're at. In my area, there's a plan that's out there for $139. It could range based on where you're located. But what's happening, with the Medicare Advantage plans, they add other benefits to the plans to make those plans more attractive. They could add things like dental, vision, hearing, over-the-counter cards. Those are things you can go and buy, Tums and bug spray and toothpaste and all those. There's a whole list of things you can purchase. They have flex cards sometimes that will help you with the cost of dental, vision, and hearing expenses. Some of them even have food cards. So if you have a chronic health condition, they can give you a food card per month that you can go down and buy healthy foods. So you'll be down vegetables, fish, beef, chicken. Can't go down and buy a 12-pack of beer with it or a pack of cigarettes. You're not going to be able to do that. But it's for healthy foods. So, I don't mean to make light of that at all. But there's also silver sneakers programs or other equivalent type of plans. Those are workout cards that you can go to the gym for free. So if you just want to go walk at the gym, you want to go lift weights, you want to go to a place that has a pool, there's all kinds of things you can get from the fitness cards that they include. So all that's packaged into a plan. Um, what happens though is that when you sign up for a Medicare Advantage plan, you will not have a supplement or a Part D card. You're going to have one of those two options. You can't have them both at the same time. There would be no reason why you'd want to have both of them at the same time as well. Um, with the supplement plan or a Medicare Advantage plan, you can enroll whenever the open enrollment period is for you. If it's initial or a special open enrollment or the annual open enrollment, whenever it's your time to enroll, you can enroll in any plan that you want. There's no pre-existing condition clauses. You don't get denied. You can come out of those plans whenever at open enrollment. You can switch all the time, and you won't have any pre-existing condition clauses. They're all HMOs for the most part. There are some PPOs out there that may have a waiting period if you don't have contiguous coverage along the way. But when you're looking at those are the only options that you have when you're Medicare eligible. Okay, so don't get overwhelmed. Don't get confused by the mailbox. Please don't. I'm just going to tell you this from advice. Please don't make outgoing phone calls or click on things on the internet, because all you're doing is setting up the. They're going to start calling you because you've allowed them. You've consented to contact them. That's one of the only ways they can contact you on the phone. Maybe some of them do it illegally. I'm not going to say they don't. There are requirements too if they're selling things on the phone to you that they have to record all the conversations, so they'll have to tell you that ahead of time. So if you ever get anybody that doesn't start the recording by saying, "Hey, I'm recording you," and doesn't know this, I mean, it's probably somebody that's not following the rules the right way. But anyway, I'm just here to tell you things. Hopefully that helps you understand Medicare and your options when you come around that time. Have a great morning and a great afternoon, great weekend. Thank you. Goodbye.